Let's get started. Hopefully everybody's having a good afternoon. Thank you for joining CIVHC today for our Data to Drive Decisions webinar series. My name is Pete Sheehan. I'm the Vice President of Client Services and State Initiatives for CIVHC. Part of my role is working in partnership with the Colorado Department of Healthcare Policy and Financing and the Colorado APCD Advisory Committee to review applications for projects funded by the Colorado APCD Scholarship Program, which is the focus of today's webinar. We are joined by three esteemed members of Colorado's research community who will share details about projects they've led that have been partially funded through the Colorado APCD Scholarship Program. With that, let's go through a quick round of introductions by our panelists. Let's start with Stacy.
Stacy's actually having a hard time getting on.
We'll start. Thanks, Danielle. Let's start with you. We'll go to Mark, and then we'll add Stacy in as she can join us.
Absolutely. Hi, everyone. My name is Danielle Klein, and I am a Research Services Program Manager at the University of Colorado in the Division of General Internal Medicine. I worked previously for about 9 years as a project manager for Dr. Stacy Fisher, working on these studies we're going to talk about today. And that's me.
Thanks, Danielle. Mark, why don't we go to you next? Or is Stacy able to join?
It looks like her audio is still connecting. So Mark Greitz, I'm at the University of Colorado School of Medicine. I have a number of different hats, and you can see by the reflection off the top of my head what switching hats does here at the university. It causes you to lose your hair. So I'm the Director of Operations at Accords, the Director of Operations at our Farley Health Policy Center, and the division head of the Division of Healthcare Policy and Research in the Department of Medicine.
Thanks, Mark. And we've had a great deal of pleasure working with Mark over the years. And then finally, we've got Dr. Stacy Fisher. Would you care to do a quick introduction of yourself, and then we'll jump in?
Great, thanks. I'm Stacy Fisher. I am actually now a professor of medicine at University of Colorado Anschutz Medical Campus in GIM. I'm a trained geriatrician and palliative care clinician and researcher. And I also am one of the program leaders in cancer control and prevention at the Cancer Center. And I'm coming to you live from the psychedelic conference, downtown Denver, of 12,000 people learning about psychedelics in emerging science and medical research. So apologize if there's some background noise.
Thanks, Stacy. We appreciate and welcome all of our esteemed panelists who will be going through, again, overview of the projects that they've completed with and partially funded by Colorado APCD scholarship funding. The agenda is up in front of you now. For those of you who may be new to CIVHC, we'll provide a brief overview of who we are before sharing details about the Colorado APCD scholarship program. Which again is the focus of today's presentation, along with the projects that our colleagues will walk through. They'll provide overviews of those projects, and you can see Stacy and Danielle will be providing an overview of their Apoyo con Cariño support through caring project. And then we'll shift to Mark, who will provide an overview of two projects, an e-consult program for the CU School of Medicine, and then the Rocky Mountain Network for Oral Health Integration. As we go through the presentation, we're going to hold questions until the end of each section of the webinar, and you can also use the chat function within Zoom to submit questions. First, a little bit about CIVHC. The Center for Improving Healthcare, or CIVHC, as we're known through an abbreviation, is a nonprofit, nonpartisan, objective organization. We were formed out of a recommendation from a multi-stakeholder group called the 208 Blue Ribbon Commission on Healthcare, whose goal is to try to address some of the issues in healthcare at the time, including cost and using claims data to address some of those questions, as well as jumping into some of the quality questions as well, and trying to improve care for all of Colorado. Our mission is to serve those across Colorado in focusing on a number of different sections of the healthcare ecosystem. We partner with all aspects of the ecosystem, including organizations that may be outside the ecosystem, to try to address cost, quality, and again, improve care for all of Coloradans. How do we do this? There are two main ways that we share information coming out of the Colorado All-Payer Claims Database, or APCD. The first is through public reports that are available to access for free on our website and provided through various partnerships across Colorado, and actually through partners we have outside the state as well. And then licensing data directly from the Colorado APCD to help address specific questions or needs. A lot of that information is made public, some of it is not. It just depends on how that specific data requester is choosing to use the data. We want to provide a brief snapshot as to what is in the Colorado All-Payer Claims Database. Currently, we've got over 1 billion claims from the years 2013 to 2022. We're excited about that. We've just crossed the billion threshold, and that's a huge achievement. And we believe we're one of the most comprehensive places to get medical claims information, dental and pharmacy claims information for the state of Colorado. We've got about 40 commercial payers, Medicare and Medicaid, that are included in the All-Payer Claims Database. And we estimate that the database covers more than 70% of the covered lives in Colorado for medical claims. We have data that goes back further than 2013, but we recommend only using data from 2013 forward due to the completeness and the accuracy of the data over those years. What's not in the Colorado APCD? So we do not receive claims from federal programs such as the VA, TRICARE, and Indian Health Services. Some of the self-insured or ERISA plans do not submit as well. We get some of those claims, but not all of them. And we do not get uninsured or self-pay claims because those do not generate a claim, actually. We do get some supplemental information, but it is not complete. So a little bit about the scholarship program. It's administered by the Colorado Department of Healthcare Policy and Financing. The program provides $500,000 annually to subsidize the cost of accessing data from the Colorado APCD for eligible organizations. And we'll talk about that. Who are those eligible organizations in a second. The funding is available on a fiscal year basis. The current funding year ends June 30th, and the next round of funding aligns with the beginning of the next fiscal year on July 1st. The funding is part of the Colorado budget and is approved by the General Assembly each year as part of the budget process. Again, it's administered by the Department of Healthcare Policy and Financing, or HCPF. So organizations that are eligible for the scholarship program include nonprofits with annual revenues of $10 million or less, governmental entities, including state, county, local governmental entities, also includes the federal government. The Department of Healthcare Policy and Financing, or HCPF, they're not eligible as the administrator of the program. And then researchers. Researchers affiliated with public, state-supported institutions of higher education are also eligible to access funding through the scholarship program. The program can fund a whole host of different types of projects, including data sets, custom reports that inform and support projects to improve the triple aim and provide a benefit to the citizens of Colorado. Listed below are a few examples of those types of projects, including benefit design, outcomes looking at cost and benefit return to different types of care settings like palliative care, community-based transition work, bundle payments, looking at cost of care for different types of provider setups such as ACOs or medical home models. That's just a set of examples. You'll see in a few minutes as we walk through different examples of the types of projects that were funded this year, that there's a vast variety of types of projects that can be served through the scholarship program. We wanted to share, as part of the information, just a little bit about the costs of the types of products and data that we can provide. Along the left-hand column, you'll see what those are. We have standard reports, which tend to be reports we run every year and are just sitting on a shelf that we're able to share through just general access. Custom reports, if somebody has a very specific question, we can generate analytics that can output a custom set of information to answer very specific questions. We also have data sets. We have de-identified data sets. We have limited data sets. Limited means there's a limited amount of PHI included in those data sets, and then fully identifiable data sets, which includes a great deal more of PHI or protected health information at the member level. And you can see there's different costs associated with each of the different levels of data that we're able to provide. And this is just an estimate of the range, the specific costs we can provide when we do full scoping of projects. In terms of the eligible organizations, here's a breakdown of just what the scholarship program actually will cover. And so for nonprofit organizations, if you have annual revenue of less than 5 million, the scholarship program typically will cover about 85% of the cost, and then the data requester is responsible for about 15%. If you've got annual revenue for a nonprofit between 5 and 10 million, the program can cover 80%, and then the data requester portion is 20%. And you can go on down the list. I won't read all of those, but that just gives you a sense as to the types of splits between what the scholarship program will cover and what the responsibility is of the data requester. And as you can see at the very bottom, requests that come in from out of state have a different split. We'll cover 50% of the project, but we have a Colorado first mentality in terms of allocation of the funds. And there's a application review process that we go through in partnership with the Colorado APCD Advisory Committee and with HCPF to ensure that the projects that are applying for scholarship are valid projects and are a good use of public funds for the state of Colorado. Historically, we've been able to serve a vast variety of different types of stakeholders through the program. And you can see just a breakdown of year over year, employers, researchers, government agencies, foundations, and healthcare providers. When we got to the end of fiscal year 20, the pandemic was occurring. The program was actually put on pause for a couple of years by the state as the funding was really directed to ensuring that we were covering the basic needs of patients going through COVID episodes and making sure that providers were covered. But the program was resurrected this fiscal year, and we're happy to have it back in place. And we'll go through a breakdown of what types of projects were included in this year's round of funding. So wanted to share just a website link. This on the top at civic.org/scholarship will take you to an informational page that has a couple of different documents, part of which we just reviewed in terms of how to apply for scholarship. We at Civic can help you do that. The different types of product types, as well as estimated cost ranges. In the current fiscal year, 22 projects were approved, totaling $417,000. The average scholarship award was just under $19,000, and the average financial responsibility for the data requester was just under $5,000. On this slide and the next slide, we have a list of the projects that were approved for funding this year. The green, those shaded in green, designate those projects that have been approved and delivered already. In yellow, we just have one project left that we're trying to complete, working to complete this week and next before the end of the fiscal year. It's still in production. But just to walk you through this, on the left-hand side is the name of the organization that requested the funds and are running the project. A brief description of the project and the project name, the total amount that was awarded through the scholarship program, what the requester amount was, and then the total cost of the project. And we have this broken into segments. The first block of projects are those projects that fell into the academic slash research category. You can see projects from the University of Colorado pharmacy program, covering things like utilization of prescription medications during the pandemic. You can also see that we had some projects from out of state that applied for funding and were approved. The next block covers government entities. Go back one slide, Spencer. Thanks. This just walks you through the types of different government entities that requested funds, including state legislative requests, and the types of projects that they had this year. And the majority of funding did go to government entities this year. And if we go to the next slide, you'll see where the nonprofit requests came from. And there are some employer groups in there that are nonprofit entities that work as purchaser alliances, like the Peak Health Alliance, that were able to tap into some of the funding this year to try to understand costs in various places around the state. But again, wide variety of organizations that were served. This year, we did not fully allocate all of the $500,000, but we did allocate over 80% of those funds the first year that the program was back from that brief pause. And this is just a breakdown as a percentage of the total funds that were allocated. Where did they go? About 61% went to state agencies or government entities. 22% went to nonprofits, and then 17% of the funds went to academic or research projects. Some updates that are being discussed for next year include capping allocations from eligible out-of-state entities at a total of $50,000 for all out-of-state project requests. And then also setting aside 10% of the annual program funds for Colorado state legislative requests. This aligns with that Colorado mentality first, or Colorado first mentality of the program, to ensure that the state is putting the funds up for this, that we're taking care of the folks in state as we look at out-of-state projects, but putting a cap on those likely for next year. And as part of the overview, we wanted to end with just a quote from one of the state representatives here in Colorado who is able to take advantage of accessing data from the Colorado APCD. I won't read the whole quote here, but just portions of it. CIVHC was able to provide me with a strong data set that illustrates the revolving door nature of mental health and self-harm visits in Colorado emergency rooms. I'm working on policies to change this and bring greater mental health resources forward, and being able to reference real data we're trying to address these situations is critical. So we were happy to support legislative requests, policy discussions with the data. That concludes the CIVHC and the scholarship program overview portion of the agenda. I'll take a brief pause for questions before we jump into the specific projects that were funded through using this program. Not seeing any questions come up through chat. So why don't we go ahead and jump in. Dr. Fisher and Danielle are going to provide us with an overview of their Apoyo con Cariño palliative care project that they use data from the Colorado APCD, and we're also able to use funding from the scholarship program to partially fund this project. Take it away, Stacy and Danielle.
Great. Well, I'll kick us off and just give you a very brief overview of the project itself. The Apoyo con Cariño roughly translates to support through caring. And it is a randomized controlled trial funded by NINR, so one of the Institutes of Health, the Institute of Nursing Research, with the aim of improving palliative care outcomes for Latinos with advanced medical illness. Spencer, you could go ahead and send us to the next slide, please. Okay, as I mentioned, it's our funding source, and we have no other conflicts of interest. Thanks. Go ahead. So our purpose was to conduct a randomized control trial, testing the effectiveness of a patient navigator-led intervention to improve patient care outcomes. So we know that patient navigators have been defined in all kinds of ways. In our trial, we specifically define navigators as lay people who are from the community who work with patients and families to reduce barriers to care. Go ahead and forward the slide, please. So looking at our background, and in the space of a 7-minute presentation, I'm gonna forgo a lot of background to say that we know disparities exist. If there is any question about disparities existing, please contact Civic and do some work within the APCD, and it will become quickly apparent to you that disparities are present and is something we're still really a challenge that we have and an opportunity to improve care. So knowing that there are multiple disparities across multiple outcomes at the end of life led to the rationale of our study. Go ahead and forward our slide, please. Thanks. So what we aimed to do in the study was to enroll approximately 240 Hispanic adults with serious non-cancer medical illness who were then either randomized to the control condition, which was our educational materials that had been culturally and linguistically tailored, or to the intervention condition, which was the same educational materials along with 5 lay navigator visits in the home. And we were looking at a number of outcomes, including kind of the patient-reported outcomes that we know we all care about, things like quality of life, willingness to engage with advanced care planning, symptoms. We also looked at how they completed advanced directives after the intervention. And then we were really interested in some of the bigger question outcomes of utilization. How did that affect hospice utilization, hospice length of stay, and this measure of aggressiveness of care at the end of life? Go ahead. Next slide, please.
All right, so
with the-
I will, go ahead, Stacey.
Oh, sorry, I was just going to say, so I just wanted to think about, and the things that we shared about what were the rationales for an application to Civic and the triple aim and things, that we were a palliative care study focused in Colorado, looking at underserved populations in both the Hispanic community, rural patients, and coming from a lower socioeconomic background. Okay, I'll shut up now. Danielle, you take it.
Sorry. I'm going to talk a little bit about our Civic application process that we went through for this project. So we did have 209 patients enroll. Our application, of course, had the 240 when we went through that process before. We were awarded in 2016 and we went through 2021. So there's a little bit of a COVID story there. But we decided early on to do an interim report poll just to kind of make sure all our ducks were in a row so that at the end of the study, we would have that final poll and work out those kinks early rather than later when we're doing an analysis. So in 2018, we did fill out the application and we were awarded a scholarship, which was very huge with our tight budget. And so we went through all those things where we were doing a built match data set. I think we had about 60 patients around 2018 that we sent over for matching. And then we just provided that PHI to Civic that included name, full name, social security number if we had it, Medicaid ID if we had it, and then MRNs if we had it as well. And then we got the claims data back and we had about 80% match. And then when we ran our final data poll, that was around COVID time. So the scholarships were not available to apply for or for anybody. So we had to scramble and find some funding, but it was so important to get this data. We were able to make it work. So we did do the application process twice because we had 2 data pulls. And I think we were identified limited data set when we requested that. So yes, next slide, thank you. So what was our question? We're asking, does our intervention group have fewer hospital admissions, visits to the ER, and costs in 6 months following the intervention than in our control group? Next slide. So specialty palliative care has demonstrated the ability to lower costs in serious ill populations. Stace, do you want to talk to the effects of our cost analysis?
Yes. So at this point, we're still working through the data and on the analysis side. But I think, what we're what we're really looking at is does the navigator save money to the healthcare system as a whole? And what we found is that when patients end up in hospice care, the navigator saves money. And so what we're seeing is that the navigator, by ensuring greater numbers of patients enrolling in hospice earlier, it does save the system money. And then of course also translates to that other AAA where you have better patient and family outcomes as a result of that high quality care in hospice. And so we're working on our final data analysis and publications on that. Go ahead and take us to the next slide. Okay. Oh, sorry, I jumped the gun a little bit on that. And so right now as I mentioned, we're finishing our cost analysis. But we will be publishing soon. And I'm happy to take any questions. Danielle is happy to take any questions, but I want to reiterate the importance of the scholarship as part of our being able to conduct this research. Had it not been for that initial scholarship opportunity, we would not have been able to do this work. And I also want to acknowledge our navigators.
Thank you, Danielle and Stacy. I'd like to open it up for questions. There was one question earlier regarding use cases, number of use cases. Does the scholarship have to be only for one specific research evaluation, or could it possibly allow for access to data to help evaluate several questions? So the answer to that is yes. For health equity purposes, the Colorado APCD data, as well as the scholarship program, certainly can be used to address those types of questions. We have to go through an application process for each release of the data, but within a data release, if there are related questions that can be addressed within the same data release, then yes, certainly we can help address multiple questions. Are there other questions? For Danielle or Stacy? There's a question on how do we find the application. I think that's more of a general scholarship question. If you go to the website, there's information on there, and you can submit information through an email link. The actual scholarship application is something that the Civic team fills out on behalf of data requesters, and we will partner with you to fill that out. And then it then goes through a review process with the Department of Healthcare Policy and Financing in a scholarship subcommittee of the Colorado APCD advisory committee. But we were happy to help you with that. More questions on the process. What's the process and timeline? It is submitting an application, a regular APCD data request application, and working with the Civic team to help us understand if scholarship is needed or requested for a particular project, which we're happy to work with you on. We then go ahead and put together what we call a scholarship binder or application request that then goes to the review committees. But it's all based on that original data request application that data requesters fill out. And again, we can help you with that. Any questions specific to the palliative care support project? Well, we want to thank Stacy and Danielle for sharing their information with us today. That's been very beneficial, and I appreciate the kind words related to Civic and to the scholarship program, which wouldn't be possible without the Colorado General Assembly, the Colorado administration, and the Department of Healthcare Policy and Financing. If there are no other questions, we will jump to Mark, who will walk us through two of the projects that he worked on that also use scholarship funding to partially fund the projects. Mark, you are up.
Great, thanks, Pete, and thanks, Stacy and Danielle. Very interesting project. As Pete mentioned earlier, I've been working with Civic in a very collaborative manner, at least I view it that way, hope Civic does, for almost 10 years now. And so, you know, I've had a large number of interactions with Civic. And so I'm going to take a slightly different approach today. You can go ahead and go to the next slide. So I am going to very briefly talk about two projects that are using the APCD and some of the lessons that I've learned from both the scholarship applications and then different ways of identifying, you know, the APCD members that we're using in these two projects. And I picked these two out of many that I've done with Civic because of the fact that they really do represent a different approach to identifying the members. So I'm not going to spend a lot of time on the specific projects and really want to hopefully share some lessons learned, because over the years I do get asked quite frequently by a number of my colleagues here at the university about advice on working with Civic and APCD data. So I'm hoping to share that a little more broadly today. Next slide. So the first project that I want to just briefly describe is an evaluation of the e-consult program that is operated by the peer, and I'll get this wrong, Peer Collaborative Care Consortium here on the university. It also runs the ECHO program for the university. And the e-consult program is an internally funded project that is funded by the School of Medicine and CU Medicine, our practice group here affiliated with the university. And an e-consult really provides an asynchronous telehealth communication exchange that's generally initiated by primary care provider with a specialist provider around a very specific patient with a specific issue that the primary care provider would like to have more insight into from a specialist. Historically, those have been handled by a referral to the specialist that required the patient to go see the specialist first. And so the whole aim of an e-consult program is to first increase access to specialty care by potentially eliminating the need for a face-to-face specialty visit if both the specialist and the primary care provider that are communicating through this e-consult program can feel that they've adequately addressed the patient's presenting issue that, you know, allows the patient to avoid having to take the time to go to a face-to-face specialty visit. If they feel that the e-consult doesn't resolve the patient issue, then the sort of e-consult is converted to a referral. So it is designed to make even those face-to-face specialty visits more efficient, because the specialist has a lot more background on the patient when they do happen to see them. We had two specific aims. One is, does the e-consult program increase access? And the second is, does the e-consult program reduce cost of care compared to patients with a traditional referral for a face-to-face? So that's the first project. We are in the middle of doing our analyses, so don't really have any results to chat about today. But I do want to kind of talk about some of the lessons learned from this. We did have what I call a finder file, which is similar to what Danielle and Stacy had for their project that I want to talk about in a minute after reviewing the second project. Go ahead, next slide. The other project we refer to as Romano, the Rocky Mountain Oral Health Collaborative. That is a project that is funded by HRSA, the Health Resources Services Administration to Denver Health. So this is actually a project that is run and managed by Denver Health, and they have Patty Braun, who is the principal investigator of the project, has asked come to the university to help her answer a couple questions using the APCD. And so we're working very collaboratively with Patty and Denver Health. And the aim of this project is to really improve access to and utilization of high quality oral health care for pregnant women, infants, and children at high risk for oral disease in community health centers, or more commonly referred to as federally qualified health centers. And so Denver Health is one of the is not only our safety net provider for Denver County and the Denver metro area, but also a federally qualified health center. She's working with federally qualified health centers in Arizona, Montana, and 4 states, New Mexico, I believe. But we're only doing this analysis here in Colorado because of the unique access that we have to payer data from the APCD. So this study wouldn't be possible, this subcomponent of the study, without the APCD. So, and our focus using the APCD is to assess the financial impact to Medicaid specifically. I'm sure you're all familiar that most community health centers patients are either Medicaid, Medicare, or self-pay, low-income patients. And so Medicaid really is a big payer for services provided. And we really are looking at early preventative oral health services on caries or cavity-related treatments. And again, we're looking at the cost effectiveness of preventive oral health care services provided by a medical or dental provider. So specifically, it's varnishing of teeth for young children, early childhood, to prevent future cavities. And their primary care providers or a dental technician working under the supervision of a primary care provider can provide the oral varnishes to patients in their primary care visit, as opposed to having to have a separate dental visit. And really, what is the return on investment to Medicaid of a practice facilitation and oral health learning collaborative, which is how Patty is working to disseminate this particular service to more community health centers across those 4 states. So those are kind of the 2 quick project overviews. They have, again, that project also doesn't have any results yet. We're still in the process. It was listed under this year's scholarship program. So thanks to Civic and HCPF for supporting that particular project this year. So as I mentioned, I really wanted to talk mostly about some of the lessons learned that we've had, or I've had over the years, on filling out the application and then some of the data request processes back and forth. And I want to emphasize that when you're filling out your data request application, as Pete said, there's really not a separate scholarship application. It's really based off of what you put into that data request. And you really want to fully answer the how questions that are in part 1 of that data release application. And that's sort of, those are: how will the project benefit Colorado residents? How will the project meet one or more of the triple aim? You can go ahead and discuss, the additional quadruple aim. And even now we're extending it to what we're calling the quintuple aim. Pretty soon we'll run out of nice short words, but and that's really, how does the project contribute to equity and inclusion types of objectives. And so if you're an NIH grant writer, you should really think about those 3 questions as your significance section. I know in the application it says something like, these are legislatively mandated questions and general contribution to general knowledge is not sufficient. Well, if you just wrote in your significance section in an NIH grant, this is an important public health issue, that's kind of checking the box, but it's never going to be sufficient. You should approach those 3 questions similarly, although I'm pretty sure reviewers don't want, 5-page answer to each of those. So try and get a very succinct answer. And, we found it's very helpful to include findings from your prior studies, if you have them, and to really highlight how the analysis you're proposing with that APCD is really going to strengthen the evidence base for each of those how questions. So I really want to emphasize how important it is to really fill those out with a way to help the scholarship review committee see how it really helps Colorado overall. Next slide. Also thought I'd just talk a little bit about, again, some lessons learned on 2 different ways of identifying your study population. And, as Danielle mentioned, if you're going to provide what I call a finder file, which is you have patients or members that you want to study using the APCD, you have to provide basically a file to CIVHC so they can identify those individuals. And as Danielle said, if you're approaching it this way, I would strongly also recommend doing the 2 data polls that Danielle talked about, one early and one later when you have everybody enrolled in your study, because the finder file process itself can get a little complicated. And so just a couple sort of lessons learned: make sure your IRB has reviewed and approved the use of your finder file, because you really are linking APCD data with personally identifiable information that you're providing in that finder file back to PHI that you probably have from the study or population that you're looking for. You do want to provide as much relevant PII as available in that finder file. I know CIVHC has a list of data elements that they like to see. And so, it's to the extent you can provide all of those, the better job they're going to do at matching, identifying your population in the APCD. And so, in our particular case for the e-consult project, we really couldn't provide full Social Security numbers, so we could only provide the last 4 digits. We ended up with about a 75% successful rate, matching rate, a little bit lower than Danielle's, but still pretty high relative to not having that. So that was a key thing. One other key thing that is in one of the application forms, and it's not really related so much to the scholarship, but you need to make sure your computing platform has adequate cybersecurity protections for these types of personally identifiable files, right? Because those are really highly confidential. You do want something that meets HIPAA requirements at a minimum and possibly even higher ones. And your data management plan in the application needs to fully describe those types of cybersecurity protections, particularly for this type of a data file. Next slide. So our Romano project, which is looking again at children served in community health centers, really we had a different way of identifying our study population. And in that case, we were looking for Civic to help us identify the children that could receive these services in both the community FQHCs that are implementing the intervention as well as those that weren't. And so we really needed Civic's help to help us figure out how best to identify members that are attributed to those providers. And my first lesson learned is, fully utilize the Civic client services team. Even before you start getting into filling out your application, they can be very helpful. And I know that Civic has expanded that team recently over the last few years, and the most recent experience I had with them around Romano was fantastic, and so they were very, very helpful. And as I said, you want to communicate with them sort of your population identification attribution plans early before you finish getting all of your data elements, excuse me, identified. And again, you want to ensure that your computing platform has adequate cybersecurity. For these, it's usually a limited data set, which will require less, but still strong security requirements. But you really want to make sure you describe those in your data management plan. So I think that was it. So hopefully folks found those lessons that I've learned anyway helpful. And
Thanks,
I saw
Mark.
a few things popped up in chat, but I was not paying attention to the specific questions.
So Mark, there was a specific question around IRB or just appropriate data use agreement. From your perspective, which path or both paths, what would your recommendation be?
I generally feel much more comfortable if an IRB is included. You always have to have a data use agreement. That's an absolute minimum. Just because, you're using somebody else's data, you need to, and Civic requires you to do that. They have their own data use agreement. So I feel a lot more comfortable with an IRB review. It's someone who's, external, even when, both of these projects are actually exempt in terms of the evaluation part because they are an evaluation. However, we still went through the full IRB process to ensure that, we're just following best practices more than anything else. So I would say both, but your individual organization may or may not have an IRB, and if it does, I would suggest using it. If it doesn't, just be very careful about how you're handling personally identifiable and PHI.
Absolutely. For the fully identifiable information, I think we require it as well. There's another question around process. And Mark, thank you very much. What Mark outlined in terms of lessons learned and just the general application process, from somebody who's experienced working with us, he did a phenomenal job just kind of outlining what we try to work with all of our clients. The process on the application, it's generally a 3-step process. The first step is contacting us with a project idea. Our team will help you with filling out the application and help steering you to the right product, whether it's a data set, what type of data set, or a custom report. From there, we'll work with you to understand if you're eligible for the scholarship fund. If yes, and it's a good use of public funding, we'll go ahead and work with you to get a scholarship application in place. The scholarship application has 2 review steps. First, by a scholarship subcommittee of the Colorado APCD Advisory Committee, And then if that's approved there, it goes over to the Department of Healthcare Policy and Financing for final review and approval. That whole process generally adds 2 weeks to the application process, just in terms of timing. Are there other questions? Seeing none and hearing none, want to just take a couple of minutes just to open the floor back up to all of our panelists today. Any final thoughts or comments on the experience you had, the scholarship program in general, before we adjourn for the day?
I would just like to add that reaching out and just getting in contact, there's a lot of hand-holding, and we had several meetings, lots of help there, and we couldn't have done it without it. So I know they have a great team and a lot of support to get you through the finish line, and it's absolutely worth it.
So there's thank you. There's a couple of different ways to do that. On the web page and through this email address that's on the screen, you're able to do that. I'm going to share my direct email address as well. The client services team is part of the team that I work with, and I'm happy to connect anybody to the appropriate person to help move data requests forward and scholarship requests. I want a huge thank you to Danielle, Stacy, and Mark. We thoroughly enjoyed all the information that you shared today. We appreciate your interest in continued use of data from the Colorado APCD and partnering with CIVHC. I also want to thank the Colorado Department of Healthcare Policy and Financing. Without them, this program would not be available, in the Colorado General Assembly for approving the funds. And we appreciate all interest in whatever we can do to help provide access to data from the Colorado APCD. It is there. Part of our role is to make it accessible, and we would love to do that for you if you have a project idea or interest in any way that the data could be helpful to you. Encourage you to reach out, as Danielle said. With that, we can conclude today's meeting. Again, thank you to our panelists. That was wonderful information today. So we appreciate that very much.
Thank you all. Have a good afternoon.